When somebody is sent to me with advanced prostate cancer, it means they've already reached a point where the cancer is by definition not curable. But having something that is not curable doesn't mean it's going to take your life necessarily. We have many conditions such as diabetes and high blood pressure, heart disease that are not curable, but they're manageable. And the treatment options for prostate cancer have changed so drastically over the last 10, 15 years that we now have so many treatment options available that this really has become much more of a chronic disease that we manage, and a good proportion of the people I work with, the people I treat, they will die with prostate cancer rather than of prostate cancer. So it is just as you can die with heart disease, but not necessarily of heart disease. And in the early 2000s or late 1990s, we had very few treatments for people with advanced prostate cancer, especially after hormone treatments no longer worked. And now there have really been, over the last 10, 15 years, there's been a paradigm shift where we have the chemotherapy that we've talked about, we have other new hormonal therapies that work much better than what we had before, and people's life expectancies with this incurable disease are getting longer and longer all the time. I usually advise my patients for their first treatment to have somebody, if possible, come with them. And that's more in case they have, for example, if they have an allergic reaction and we have to give something like Benadryl that might make them drowsy, so there's somebody there who can drive home with them if necessary. After the first visit, if things went well, usually things are going to go well on subsequent visits, and a lot of my patients end up driving themselves in if the first visit went well. It might sound silly, but bring a good book with you, because you're going to be sitting in a comfortable chair for a few hours while the infusion goes in, and you can watch TV or read a book or do whatever it is you like to do. If you like to play games, bring those. Pay attention to your body, and when you're working with your healthcare team, it's important to make them aware of any changes that you notice, and let them guide you in terms of whether those changes are important or not. Main message I would want to bring back to them is that, like so many other chronic diseases that we manage now, the goal of managing these is to maintain the best quality of life and as normal a life as possible. And so, often I'm asked about, are there special diets we can pursue, or are there special alternative treatments we can pursue, or anything else we can do to try to deal with this. And my answer really is to maintain a normal, healthy lifestyle, and that means eating well and being active and doing all the things you would, or at least should, normally be doing anyway.